what we've been doing was probably not the best way of doing things. And we need to be okay with that self-reflection and be willing to change because there is a better way. There's so much research coming out even now showing better ways.
Welcome to the Medical Trauma Support Podcast, the show where we shine a light on the hidden impacts of medical trauma, explore tools for healing, and empower you to take control of your health journey. I'm Sarah, your host, a passionate advocate for trauma-informed care, somatic healing, and compassionate conversations. I'll bring you expert insights, healing strategies, and personal stories of resilience to help you feel seen, heard, and supported on your path to recovery. Hello, everyone, and welcome back to the Medical Trauma Support Podcast. Today, Mary Jenner, the founder of the Butterfly Pig, is here to talk to us, and I'm really excited. Hi, Mary.
Hello. Thank you for having me on here. I'm excited too.
Yeah. Well, so I just gave just the tiniest little bit of information about you, but I was wondering if you want to tell the audience a little bit more about your background.
Yeah, my background is in nursing. So I started my nursing career in pediatric oncology and then did a good portion of it in adult oncology as well. And then mid pandemic, during my maternity leave, I opened the Butterfly Pig where we make medically inclusive toys. And it has really grown into this larger mission of helping hospitals and families have tools to help teach their kids about their medical conditions and really about preventing medical trauma.
So when I first saw what you were doing, I was like, it was so impactful for me. It's actually hard to kind of find a word for it because, and I've shared on this podcast before, the thing that pulled me into studying medical trauma was my experience as a parent with a child who had medical trauma multiple times in the first 2 years of their life. And I didn't even know medical trauma was a thing. Nobody was telling me, oh, well, if this is going to happen, this could impact them emotionally. Nobody was like, here's a book you can read to them to help understand the experience. Even though they were very little, I still fully believe that there are things we can do to help prepare and help support every child, both before, during, and after. And so I'm so happy that you're doing what you're doing. I wish that you had been doing it in 2011,
Me too.
but I just feel like for whatever reason, right now, there are so many people that are realizing medical trauma is a thing. There are providers recognizing that. There are therapists recognizing that. And there are people who've experienced recognizing that there is a name, that it's medical trauma for what they've been through, whether as a child or an adult. So I wish I wish I had those resources back in 2011, but I'm so happy that they're happening now. So,
Yeah.
thank you so much. And I'll tell the audience, right before we started recording, I told Mary that I'm like fangirling all her posts on Instagram because they're so good and they impact me really deeply.
Yeah. And I've found lately I've had a couple posts go not viral, but very popular around medical trauma. And it's interesting seeing the responses to it in the comments. The
Yeah.
vast majority are people wanting to share their own stories and validating it exists, but there are also comments about that's just how it has to be and their physical safety comes first and you're just shaming nurses, and it's really odd that that's what we go to. And I think that it's hard to change the way things have always been done.
Yes.
Well, like even myself as a nurse holding kids down, this is what we have to do. This is what's best for them. And it's uncomfortable to accept that what we've been doing was probably not the best way of doing things. And
Right.
we need to be okay with that self-reflection and be willing to change because there is a better way. There's so much research coming out even now showing better ways.
Yes. Yes, yes, there are better ways. Your products are like such a huge part of that too, because we know like preparing the kids in advance, there are things you can do during the procedure, both as the parent but also as the medical provider, and things you can do after to let them play with the toys and process it. I
Hmm.
think play therapists should all have these because medical trauma is so common. But I
Yeah.
want to back up a little bit and say it is hard to change systems.
Yeah.
We're going to, we're both in this space where we're wanting to make change in systems, and we know that there's going to be pushback. And I'm so surprised by the comments that you talked about, but also kind of not.
Yeah, I know. And it is interesting. Because I do, it was funny. Somebody was saying a while back that in order for posts to like gain traction, you need to say something polarizing. And at the time, I remember thinking, nothing I say is polarizing. Everyone believes in what I'm advocating for. But it's funny now I'm seeing that it's, yes, everyone believes that kids like should be respected, and it's easy to say that, but then where you start getting in the nuances is they think that it's a necessity to hold the kid down, because there were people that were trying to defend me in the comments and saying, well, she's actually just saying that medical trauma is a thing, and then other people were saying, no, she's actually saying that you can prevent it, and I'm like, yes, you can prevent it.
Both are true. Like medical trauma is a thing. We can prevent it. And even if we don't go to the point where we totally prevent it from happening, we can at least minimize it, right? We can
Yes.
minimize. And then on the other end, we can heal from it.
Yes.
So if
Yeah.
we do, because there are going to be experiences that are traumatizing that happen medically.
Yes, there are some trauma. There's trauma that's not preventable. That's, yeah, of
Right.
course, just going to
Right.
happen. But there was a study in 2023, and it was a randomized control trial in an emergency department. And they gave any kid needing a nebulizer treatment a toy nebulizer to play with, or the control group, they didn't get the toy ahead of time. And they measured with the approved scales to measure fear and anxiety. They measured the anxiety before and after.
Mhm.
And the kids with the toy, their anxiety and fear decreased. And then the kids that were in the control and didn't get the play, their anxiety and fear increased
Yeah.
afterwards. So it it seems so obvious when you think about it, like where we are now, that stuff like
Right.
this would help, but it we do need these studies to show like the healthcare executives and people in those positions to make change, that there are things out there that can help.
Yeah. One thing that I was curious about is how did this happen? Like how did you start this business? You said you were on maternity leave. You are a nurse, a pediatric nurse, but like how did you come up with this?
So I've always wanted to do something creative. Actually went into nursing because I loved healthcare, but I also like wanted to design wedding dresses. But I went into nursing knowing that I would, or thinking that I would have more time off to do something creative on the side. But as I was working as a nurse in peds oncology, that's where I first saw the need for it, where I would put our little IVs, without taking the needle out, obviously, into the teddy bears and demonstrating what I was about to do before a blood draw, and just seeing the shift and how much it helped kids to truly understand what was about to happen by being able to physically interact with it hands on.
Yes.
And that's where I recognize the need for more tools like this, because there's only so much you can do using hospital supplies, and we're not really supposed to waste hospital supplies in that regard. But mid pandemic, on maternity leave and amidst California wildfires, I was stuck inside.
Mm.
So I started doing creative things out of clay. I was making like little ornaments and things. And someone reached out and asked if I could make a cochlear implant out of clay.
Mm.
So I did, and then somebody else saw that, asked for hearing aids, someone else asked for a G tube, and then that's where it clicked for me that I could possibly be the one to make those toys that I wanted when I was bedside. So then I dove into figuring out how to make toys. Like, what is that process? How do they get safety certified? And how could we make them at scale? And it just kind of was one step at a time from there.
That's so cool.
Yeah. So it's been 5 years now. And now we have, gosh, 26 3D printers, and we've designed over 90 different medical toys.
Wow, that's amazing. And for, people that are listening, I know that you share on Instagram and I know other social media platforms. You share videos of the toys and how they can be used, and they can obviously go to your website and find the toys and see what the different options are. I, I'm also curious about, being a parent, how you've used the toys personally.
Yeah. I at first it was more about inclusion and representation because during the pandemic, since we weren't getting out in the community, I actually to fund the making of the toys because I was charging like $10 a piece for hours of work. So I was retailing diverse dolls. So I had like dolls with all different skin colors and dolls with Down syndrome features, and I was teaching my daughter about just physical differences you might see or medical devices like hearing aids. And so that was how I initially used it. But then last year, when my second daughter was born and had severe hypoxia, she was in the NICU for a couple weeks. And because my daughter had the exposure to the toys beforehand, when she went in to meet her sister for the first time, she was just excited. She recognized the CPAP and knew exactly what it was. It was really cool to kind of see the full circle moment of how much these toys helped prepare her to see her sister, not have any fear associated with it.
Yeah, that's amazing. And that also brings me to the when kids are having a medical experience, it's actually an experience that the whole family has. I'm sure when your daughter was in the NICU, it was a really challenging time for you. And to think about the parents and the siblings and how these can help support the siblings as well,
Mhm.
because it just has such a big impact on everyone.
Yep. I know. I think that experiences definitely opened my eyes more to all the different levels of how like trauma affects
Yeah.
people, and especially being parents, because I feel like for me personally I was just in survival mode, and it was really hard to be present for my 4-year-old at the time because I was, I think, just so consumed by the fear and the what ifs, and I didn't know how to be present for her. So I wish that I did actively like play with the tools with her and show her, but she already saw them and we played with them all the time at the office. So it was a nice way, even though I wasn't mentally there, to like still show up for her by her being able to interact with those toys.
Yeah. Yeah. And I think what you're bringing up to the experience that the parents are having, and like we're only human, right? So, like, as a parent, I've been a parent for close to 15 years now, and there's so many things that I would change, right? If I could, with what I know now, and it's like, I could just like feel, I don't know, I could feel some of that emotion that you had about like, I wish I could go back and I could do that. Like, we're always doing the best we can in every moment. It is so hard on parents when our kids are having a medical experience.
Yeah, and it's hard to feel empowered enough to say to put a pause on what's happening, because I even me being an advocate for preventing medical trauma, just a couple months ago, maybe not even, my year and a half toddler had to get a straight cath because we thought she had a UTI.
Yeah.
And it was a terrible experience, and they said I wasn't holding her down hard enough. I felt like I was bruising her arms. They brought in another person, and I just should have like made them all take a breath. It was so traumatic. Like,
Yeah.
it's things like that where like in the moment, like, you even having all the knowledge that I have now, when you're actually in the moment and emotions are flying high, it's really hard to speak up and prioritize emotional safety.
Yeah. It really is. I think that's so important for everyone to understand. Like, let's have compassion for all of us as humans doing the absolute best that we can. Is it is really hard in those settings. And I keep going back to being a parent in that situation. And you shared your story. And yeah, especially when you haven't been taught how to advocate, you haven't been taught that there are things that you can do and you can ask the medical providers to do to try to minimize trauma. Like, I didn't have any of that. And I
Mhm.
know the majority of the parents whose kids have gone through medical experiences have not had that. And so
Right.
it's like, I want to just like give you and I both like just big hugs because it's so hard and we're human. We're not going to do it perfectly. Hindsight is 2020. Like, we can look back and we can be like, man, I wish I could have done that. I wish that I had been able to slow down and do this. But I keep going back to your experience with your baby in the NICU. And I think also about all of the hormone shifts on top of your baby being in the NICU.
Yeah.
And it's like, what I think you today wish that you had done was probably not even within the capacity of a mother who has just had a baby and the hormones are shifting like crazy.
Yeah, that's a good point. I definitely don't think I would have had the mental clarity for anything or the desire. I was like barely surviving. So, yeah.
Yeah. Yeah. And I think that is an important thing for all parents to hear, right? So that we can all let go of some of our like guilt and shame about
Yeah.
not doing it perfectly because we're human and we're not gonna be perfect.
Yeah, and for all parents to hear that going forward, even if they don't know how to advocate or what resources, they can ask, hey, do you have child life specialists here? Do you have any other measures to help with needle pain? And when my toddler went in for injections, I actually asked that for her vaccinations. And they said, oh, yeah, we have the Buzzy Bee. So then I could say, okay, can we please use that? But she was already at the, chair side ready to give it. So it's something that we do have to ask for a lot of the time.
Yeah.
But I think that that is what's going to help the culture shift
Yeah.
is families learning to ask for these resources too. And then slowly these centers and hospitals will get on board and ideally invest in more tools like our toys or the Buzzy Bee and cold numbing sprays. Like, there's so many things out there that they are just not investing in yet because they don't see the necessity yet. Another, it just brought me back to one of the other comments was a provider saying it takes too much time.
Mm,
I think that is a huge barrier for people
yes.
to provide emotionally safe care. But what I don't think we realize is it's the fear and the anxiety, the trauma that compounds after that initial encounter. It takes more and more time to
Yes.
prepare and try to get kids through procedures. So if we just take 5 minutes to use a cold spray and a Buzzy Bee, like, it is so minimal. We can really improve our time efficiency. And I think is just what we need to get out there.
Yes, I agree with you. And then the other thing is when we help prevent and minimize medical trauma, it actually makes medical providers safer
Yeah.
because, medical providers have been attacked. Like, it's not an uncommon thing that happens. And I think there are probably times that people have experienced so much medical trauma that going in to get any kind of medical treatment, their nervous system is in fight or flight. And
Mhm.
when they're in fight, that's when they're irritable, more likely to attack someone because they see them as a danger and think they have to fight for
Yeah.
their safety and their survival. And it benefits everyone to take that extra time. And I've talked to enough medical providers. I understand that this system is like making it almost impossible to have the time that you need. And they're squeezing medical providers and getting every single thing out of them. And that hurts everybody. That hurts the providers, that hurts the patients. So It's even bigger, right? It's even bigger than
Yeah.
what we're talking about today. But like you said, there are things that you can just incorporate in your practice. So we also, once I learned about advocating, actually part of my journey was when I became a doula in 2014, is when I really learned about advocating within the medical system. And it's really about just asking questions, finding out what the options are. I think a lot of times people think advocating means like combative. People have probably had that experience because not everyone is open to the questions and wondering what the other options are. But advocating is really about questions, like asking
Yeah.
questions. Is there another way to do this? And since then, I am the parent that shows up and asks a lot of questions. So I am
Yeah.
one of those parents. And I also now talk about medical trauma with all the providers that I see. I talk about medical trauma with the providers my kids see. I watched a dental trauma happen and had to advocate for them. And I have now been watching trauma responses happen every time they go to an orthodontist or a dentist, and that's really challenging.
Yeah.
And it's like if things had been done a little bit differently with these providers we go to now, their jobs would be a lot easier, right? Now it's like this long process of getting my child to be able to calm down, to lay down, to breathe. The whole reason that I was drawn to study medical trauma was my other child who experienced it very early on. When we would go into medical appointments, would react in sympathetic charge. So either fight or flight. So either yelling
Mm.
or saying they were going to run out of the room. That's really hard. It makes everything harder. Like there was a time where they left, and then for us to come back we had to pay $100. I know. It didn't feel very trauma informed, but I was also like, I get it. We did take an appointment spot, but it's like, just like you said, like if we can really be aware of it early on and try to prevent the medical trauma from happening, it makes it easier for everyone, not only the kids, the parents, the families, the providers.
Yeah. That is the one thing where I see that our toys really can help with the time issue also involves incorporating the parents,
Yeah.
because there's studies showing that if parents are involved in preparing and educating their kids, then the anxiety of both of them drops. So the
Yes.
parents are more relaxed, the kids are more relaxed, and there's better patient satisfaction scores, they're more cooperative. There's data on all of that. But right now, often when we're parents at the bedside, we don't know what's going on half the time. So it's how do we empower the parents to be
Yeah.
involved in that education and preparation process? And that's where if you hand them toys, like they know how to play with their kid. There's no wrong way to play. They don't need to know all the special terms. Really, it's just letting the kids see these realistic toys, getting familiar with them. So when the real echo machine rolls into the room, they're not panicky, wondering, what is that? They're, oh, hey, I have that.
Yeah, and actually so I need to share this more widely, so I'm happy we're talking about this. In my master's in social work program, when I did the medical trauma study, the product that came out of it was actually a handbook for parents. And it was how to support your kid before and after procedures. And so I feel like handing them your toys and handing them a little handout, it can be just one page even,
Yeah.
mine is a few pages, just to give them something, right? Like, and I want to acknowledge that when we are there as parents and there is something going on with our kids medically, we are terrified.
Yeah.
And when you're terrified, you don't have all your, thinking capacities available to you.
No, I remember even so, as working in oncology, I would tell my patients all the time, do not Google. Whatever you do, don't Google stuff. But like when my daughter was taken up to the NICU, I was on Google, like all of my logic went out the window, and I saw terrible studies and I just spiraled. And it's like, it's even no matter how much training you have, like when you're at the bedside, it's just goes out the window.
Yeah,
Yeah.
because you're not yeah, like your nervous system is not preparing you for danger, right? It's not preparing you to have like a logical conversation with somebody and remember all the points that you remember all the questions. So yeah, it's really hard, and I think like you said, like providing parents with resources is such an important piece to this, educating providers as well, but parents. And I'll go to something that I talk about a lot that's huge is having community for parents whose kids are going through hard medical experiences. And that is what I'm working on right now. Is right now I have the Befriend Your Body community, and I'm creating a space for parents. It's like a space that I wish that I had just to go and be with other people who understood the terror, really. I mean, it's not just a little bit of fear. It's terrifying when there's something going on with your kid and to not be able to have control. Like, you want to be able to fix everything
Yeah.
and you can't.
And I remember I did find a community because she had HIE. There is a parent community for HIE.
Yeah.
Mostly it's talking about the kids, but I did feel like myself, I probably needed a therapist. I definitely needed a therapist, but like I wanted to talk to somebody about like how I was questioning what if I did this instead during birth, or like, is this my fault? Or, like I ended up having that conversation with other people, and it was just really validating to know I wasn't the only one going through that. Like, nobody needed to change my mind and reassure me. I just needed that knowing that somebody else was going through the same problem.
Yes. 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 Like being with other people who get it. And my husband and I found out when I was pregnant that there would be some needs for medical intervention at birth, but we didn't tell anyone. Like, we didn't tell anyone. We were totally alone in it, which is like the opposite of what we really need. But I didn't know anyone else who would have known how to respond well. And so if I had been able to go into a community like this of other people who get it, who'd been around it and knew what it felt like and how to respond, then we wouldn't have just been sitting there alone with it and scared and having no idea what was going to happen. Yeah, we do. We
Yeah.
really need that community.
Yeah. I know. I think it's great that you're building that. Definitely a need.
Yes, I'm really excited about it. Well, I'm curious if there's anything else that you want to make sure that people know. Like, I always try to like wrap these up with, what do you want to leave the audience with? What is like an important piece of information that you think everybody should know?
Well, I would say we already touched on the advocacy thing where I want them to feel okay being the squeaky wheel and advocating for their kid and not being afraid to take a pot. Anybody in healthcare, if it's a parent listening to this, a nurse, a medical assistant, if something feels wrong or if a kid is expressing resistance, like it's okay to ask for a pause to like really recollect. And in terms of the medical play, I would recommend that everyone checks out in the app store. We have a free Playful Prescriptions app. So it's a chat based app where you can say, I have a 5-year-old with asthma, and it'll pop out 3 different play ideas. And we call them Playful Prescriptions, and they don't require buying any toys or anything. It's all stuff that you can do at home. And if you're in the hospital or your child has specific needs, you can add those in. Like, we need activities in a hospital bed or activities around teaching about blood. It'll pop out ideas for all of those. So
That is
it's,
amazing.
yeah.
Yeah, that is amazing. And I love what you said about just like asking for a pause. Like, wait, let's just take a second. It would be ideal if everybody would just take a deep breath and let it out together.
Yeah.
Um, I think that's really beautiful and like easy for people to remember. Like, oh, wait, let's just take a pause.
Yes. That is the sister business that's in development, will be promoting a pause like that to hospitals. So there's
Wow.
more to come on that concept.
Yes. Well, that's so beautiful. I'm so happy to hear that. One other thing when you were talking about the Buzzy Bee and the cold spray. So as now I advocate and I ask for extra things at medical appointments. They have another one that I just learned about like about a year ago. And this has got to cost like pennies to make this, I think. But it's shaped kind of like U, like a really thick U, and it has little points, like a lot of little points, and you just put it against the skin. It doesn't go in, it's not going to poke into the skin. It's not going to pierce anyone's skin. And so you would put it on your arm or your leg. And so what happens is the skin is sensing that input so that in the little open spot of the U, the shot goes there, the vaccine goes there, and it's not, it does something to where it's not as obvious to the kid
Yeah,
because they're already feeling the sensations around it. And that was actually really helpful for one of my kids who has like a
that's really
big fear of
cool.
needles. Yes. And so it just, I wanted to add that because when you were talking about like the Buzzy Bee and the cold spray, there are so many different options. And I think, we think about cost and we think about time. And I know that thing does not cost a lot. It cannot possibly cost a lot. But we actually kept it. We asked if we could keep it. So now I take it with me anytime we're going to a doctor's appointment where there might be a vaccination or something.
That's amazing.
Yeah, and we also bought a Buzzy Bee. So I learned about a Buzzy Bee
Yeah.
from our pediatrician's office when we asked for extra support. And so we have one. And so we have our little, so for people that don't know what a Buzzy Bee is, it's a little device that vibrates, but there are these wings that, and one looks like a cat, like a butterfly too. I think there's a
Yeah,
couple
there's
different.
a butterfly, a ladybug, and a bee. Maybe one more now too. I can't remember.
Yeah, and so the wings are actually, you freeze them. So they have like the liquid inside and you freeze them, and then you tuck them onto the vibrating body so you get both like the cold and then you also get the vibration, which is I think kind of similar to what this thing is that I was describing. Kind of distracts you a little bit because you're feeling the buzzing, so you're not feeling the needle as much as if like there was nothing else happening, and that is the one
Yeah.
sensation that is
Yeah,
happening.
it releases certain neurotransmitters that block the pain signal too. So it's yeah, lady who made it's phenomenal. So we need more stuff like that.
Yes, we really do. So we need your toys, we need the Buzzy Bee, we need the cold spray. I don't know if other families have had as many experiences as we have. Probably so. I mean, I have so many different experiences with my kids, but one of my children had to go under general anesthesia. And this was after I'd done my research and was like really aware of like medical trauma, advocating what can we do to try to prevent it. So I actually went and got my handout. Like I did the things and I was like, wait, did I do everything? I got my handout and I was like, wait, no, like I didn't get a book. Like let's get a book. Let's bring in the book. I didn't know about your toys yet, but that would have been something else that I could have brought in. The experience after knowing and the experience from my first in the first 2 years of their life, and then this experience was so different because I had so much information, and so I did things at home. But then because I knew about like advocating and asking questions when we got there, and the anesthesiologist came out to meet us, my child had questions that I couldn't answer. So we had them ready for the anesthesiologist. They answered them. They were so kind. They actually brought my child back to see where she would be. And so they let her push the button to open the doors that took her back. I mean, it was
That's amazing.
so beautiful. So it's just like that kind of sums up, I think, a lot of what our conversation was today is like when we can teach parents how they can support their kid and how they can ask the medical providers to support their kid.
Yeah. And
That's huge.
we do also, because hospitals, they care about what the parents want. Like they want patient satisfaction scores to go up. They get reimbursement for that. Like they want to make like all the parents happy. They even advocating and asking for these types of resources to be available. That's what'll get them there. If they don't have the Buzzy, you can ask, can you get it? And they may not, but the more that we ask for that type of thing, they'll see the demand. We even in the FAQ page on our website, we have a printout where families can bring a flyer about our toys to hospitals or doctors' offices.
Yeah.
And it just helps spread the word. And when they see that people want it, then they will advocate also getting these types of tools internally.
Yes.
And you never know, if you ask for them, they might already have them too. So,
That was our experience, was that
yeah.
when we asked, they were like, "Oh, yeah." But it hadn't
Hmm.
been top of mind. Well, this has been amazing. I'm so thankful for you sharing your time and sharing your story and really spreading awareness of how we can really, really significantly minimize childhood medical trauma.
Yeah.
So I will put like your website and links into the show notes, but I'm just curious if there's anything else you want to share with the audience about You mentioned you have something else coming out. I don't know if you want to share anything about that yet, about your sister company.
It will be about getting hospitals on board with preventing medical trauma and helping them find the resources and tools to help do that too.
Yeah.
So it is hopefully in the next couple months here.
That's amazing. That's wonderful. Well, thank you so much for being on.
Yeah, thank you. This is wonderful.
Thank you so much for joining us today and listening to my conversation with Mary Jenner. I hope you found this episode helpful, whether you're supporting a child through medical experiences or healing from your own. Before we go, I'm excited to share a special resource with you. I've recently updated my parent handbook, and for the rest of the year, it's available completely free. This handbook is full of practical tools and insights to help you support your child, feel more confident, and create a sense of safety during medical experiences. After this year, it will be available for purchase, so now is a great time to grab your free copy. You can download it on my website at medicaltraumasupport.com. And if you're looking for more resources, guides, and support for parents, you can always explore the parent resources section on my website. I create content to help you feel empowered and informed as you navigate medical experiences with your child. Thank you again for listening. And if this episode resonated with you, please consider subscribing, sharing with someone who might benefit, and leaving a review. Your support helps us reach more parents and caregivers who need these resources. I'll see you next time on the Medical Trauma Support Podcast.